Dr. Toby Trahair is a staff specialist in paediatric haematology and oncology at the Kids Cancer Centre. He's a clinical research fellow at the Children's Cancer Institute Australia for medical research and a conjoint lecturer at the University of New South Wales. He's also Angus's treating physician, and we're delighted that he's here today. Please welcome Dr. Trahair.
Minister, honourable members and senators, it's a privilege and I'm very humbled to be here today to speak to you. As indicated, I'm a children's cancer specialist and I've also looked after Angus. One of my roles is really to have lots of difficult conversations with families like Trish and Angus and Steve to tell them that their child has got cancer. And in many cases, things go well. But there are also many times where things don't go well, as Trish has outlined with Angus. And again, one of the real challenges that we face as an individual clinician is you need to do the best for your patient and you need to be up to date with what is current and what are the best available therapies. And it's also very clear that we're living in an age where there have been great improvements in medical research and the understanding of the biology of cancer, which has also led to the development of new agents and new treatments. And again, those new agents and new treatments, they go into trials. Sometimes they're available here in Australia, sometimes they're not. But once the trial data becomes available, you really have that onus to then discuss the results with your patient and the family to say, well, look, there is this new treatment. So in Angus's course of his treatment for relapsed Hodgkin's lymphoma, it didn't go very well at all. So unfortunately, he had some early response to treatment and then the lymphoma stopped responding to treatment and he then required radiation therapy and a transplant. And at the time that Angus had his first relapse of his lymphoma, we didn't actually have any data that had been published about using the brentuximab after transplant, and that data became available throughout the course of his relapse journey. So it's a hard conversation to say to the family, your child's relapsed. It's a hard conversation to say to the family, treatment's not going well. But it's an even harder conversation to have saying, well, there's this new treatment that looks like it's effective. It is effective. There's good trial data to show that it works. And although the drug has been used in Australia and is available, it's hard to access because it's not approved for this particular indication. And so on the one hand, you need to be able to do the best for your patient. You need to be able to be up to date with current therapy. But then it creates the problem that you need to then be able to, if you're going to talk about this current therapy, you need to be able to find ways to access that therapy for your patients. And so from that point of view, this is a challenge that faces many cancer clinicians and in many different settings. In some regards, with the disease of Hodgkin's lymphoma, we were lucky in the sense that we had good trial data to base the decision to think about offering this therapy. And although we struggled initially to find out how to do it, we got excellent help from Rare Cancers Australia. We did get support from the drug company and we managed to find a way through so that we were able to get some funding available to be able to offer this treatment. However, there are many other rare cancers in Australia. There are also many other new treatments that are coming out for rare cancers as well. And so this is an issue that is faced by many individuals and many clinicians. And again, there's often no simple or clear path to be able to access each individual medication. So it's a problem that's well recognised, and I know government is very well aware of it. I know the community is very well aware of it, and I know also the pharmaceutical industry is also aware of this as a problem. But it's also very important to be aware that it is time critical, because once you identify that you need to use a treatment for your patient, it's important to be able to access it in a timely fashion. In some regards, this isn't a new problem. One of the real pleasures of my job is that we have a survivorship clinic. And so in that survivorship clinic, we see patients that have been treated for cancer as children, and we see patients that we treated as children for cancer back from the 1960s and 1970s, 1980s in our long-term follow-up clinic. So when I started my training, we had a lady who at the time was in her late 30s, early 40s. Who'd had a very difficult journey with kidney cancer. And I was working with one of our senior nurses who's been part of our unit for a few decades. And she told me the story that she can remember the consultant who set up our unit, sitting down on this child's bed at the time, talking to the family. Well, look, there's this new drug. Hasn't been used a lot in Australia. It's only just become available. We haven't used it in very many children. But it worked for her, and 30 years later, she's alive. She's had a family, and it's amazing to see what type of impact that can have in the long term. I think we need to think about the rare cancers today, the new therapies that are coming out. They are new, they're exciting, but in 20 or 30 years' time, many of them will be standard of care. And so I think the real challenge today is to continue to be able to be contemporary with cancer research, to be able to continue to find new targeted treatments and new treatment pathways for individual cancers, and to be able to access those treatments in a timely fashion for every patient at the time that they need it. And so from my perspective, it's been a real privilege to work with Angus. He's a delightful young man. He's an exceptional young man, but it's certainly been a hard journey. And I think difficulty accessing medication has certainly added to the stress, anxiety and worry associated with the treatment of his cancer. So from my perspective as an individual clinician, I would like to see that the release of this report helps galvanise our community, our government, and also our pharmaceutical industry to help solve some of the problems in accessing new cancer therapies for difficult situations. Thanks very much for your time.